Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. Our guest today is board-certified orthopedic spine surgeon, Dr. Neil Pasia, and in this program we're going to be talking about neck pain. Dr. Pasia, welcome back to Today's Health.
Thank you very much. It's nice to be here.
Let's talk a little bit about the anatomy of the cervical spine or the neck.
Sure. Well, the basic function for a person's neck is to hold up their head, obviously. And that's essentially comes down to holding a bowling ball on top of your shoulders. That's not a simple task all the time. Obviously, there's a lot of complexity that comes with allowing your head to move around, to stay supported, to be stable. And there are 7 cervical vertebrae, all right, the bones stacked one on top of another, connected by their joints called the facet joints, with the discs, or the intervertebral discs in between them. All of that is housing the spinal cord, which is an extension of a person's brain and their central nervous system. And around there, in order to give that support and allow that motion, it's surrounded by tendons, muscles, tissues that all have to work in conjunction to hold and support that bowling ball on top of a person's neck.
And we've all watched a baby wobble around, so we know how heavy that head can be and how strong that neck needs to be. So it is a complex structure. What are the common causes, things that can cause neck pain?
There's a lot of things that can cause neck pain. Other than a person's relatives or other issues like that, there's certainly the muscles, the tendons. Those are the most common things. When those get strained, when there's a sprain in the muscle or small tears in the muscles, that can certainly give pain, which can be usually limiting for people. It extends further than that. The joints themselves, the facet joints, they can wear out. The discs themselves can get degenerative or can herniate. All of those things certainly can cause pain. Pinching of the nerves. That definitely is a big issue for a person getting pain in their neck and also down into their extremities.
Are there things you can do to prevent neck pain?
There are a lot of things you can try to do to kind of keep the pain under control and to try to prevent that pain from happening in the first place. A person's posture, for instance. As we all start to slouch, that kind of brings our thoracic spine forward, and then we have to extend our neck further in order to kind of maintain our gaze and our ability to look about the world. Well, if we can correct our posture and keep our muscles strong, most of the muscles that are really giving support and giving strength are on the back side of your neck and the back side of your back. And by keeping those strong and loose and flexible, that definitely gives better support for your neck and can prevent a number of different issues for degeneration. Beyond that, it's a bit of a process of aging that things start to wear out, and so it can be tough to kind of get rid of all the pain or prevent all the pain altogether.
Well, that was my next question is, are there groups of people or are there activities that increase your risk to have a problem with neck pain?
Groups of people, certainly because it is a degenerative process. People who are older are more at risk because the discs wear out more, the joints wear out more, and so that can cause pain and can pinch a person's nerves. Beyond that, certain activities, lots of overhead activities or excessive strain, that certainly can cause problems down the line and in the future. Repetitive trauma, athletes, football players in particular, contact sports, certainly those cause different issues globally throughout a person's body, but can also affect their neck quite a bit.
You've talked a little bit about muscle strain, and we've all woken up in the morning with a stiff neck. Are there different symptoms for muscle strain than there are for the more serious problems?
Well, sure. Muscle strain certainly in and of itself is a serious problem. It leads to a lot of debility and can really interrupt a person's day-to-day activities. Generally, muscles strain, and when a person wakes up, it's because those muscles are spasmed or can be torn to some degrees. Oftentimes it is an injury, but other times it can just be the way we sleep or the way we hold our head and neck at certain positions. The symptoms of those tend to resolve quite well. Usually it's a spasm, and when that muscle gets knotted up, it hurts just as much as it can hurt just as much as anything else, and can really lead to a lot of debility. Usually it'll settle down with a little bit of time and some gentle stretching and trying to resume normal motions. Generally it's not unstable, and a person can kind of continue to go about their activities as they feel comfortable. The difference lies when there is something more serious or when there's something more mechanical with the skeleton or a breakdown in the underlying structure.
Lots more to talk about, but we're going to take a break first.